Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then chromophobe carcinoma, chromophobe renal carcinoma. Chromophobe renal carcinoma is only present in 5% of renal carcinomas or chromophobe renal carcinoma. This chromophobe renal carcinoma contains cells, and these cells have a prominent cell membrane with eosinophilic cytoplasm. So this is a prominent cell membrane with eosinophilic cytoplasm, and there is a nucleus is present, and around the nucleus a halo is seen. So it is something like this: cells with prominent cell membrane. The cell membrane is prominent, surrounded by the transparent cytoplasm. Relatively transparent cytoplasm will be seen with a reticulate pattern also. So because of this transparent cytoplasm and reticulate pattern, we have plant cell appearance, and this is the nucleus. Surrounding the nucleus, hollow is also seen. So this is about the chromophobe type of renal cell carcinoma. Then if you see the prognosis of this chromophobe type of renal cell carcinoma, this is actually associated with the best prognosis. And these tumors, genetically, if you see, these tumors are mainly composed of multiple chromosome loss. The multiple chromosomes which are lost are, these are the chromosomes which are lost in the renal cell in the chromophobe type of renal cell carcinoma. There is loss of chromosomes 1, 2, 6, 10, 13, 17, 21. Y are lost, and the patient will also present with extreme hypodiploidy is seen on histological examination. The main origin of the chromophobe renal cell carcinoma is from the intercalated cells of the collecting duct. So origin is from intercalated duct of the cells of the collecting duct, and it is mainly composed of pale eosinophilic cells with perinuclear halo is also seen, which was already said. So in the chromophobe renal cell carcinoma, it is seen in 5%. Prominent cell membrane is seen with eosinophilic cytoplasm with a halo around the nucleus. Relatively transparent cytoplasm is seen with reticulate pattern. It has a best prognosis, and multiple chromosome loss like 1, 2, 6, 10, 13, 17, 21 Y are associated with it, and it is arising from the intercalated cells of collecting duct.
thank you and thank you for watching.